Welcome back to the Bentonville Beacon podcast, where we're sharing stories and advice from the entrepreneurs, business executives, and community leaders sparking the rise of the greater Bentonville area, which represents one of the fastest growing and most dynamic cities and economies in the United States and is nestled in the Ozark Mountains of Northwest Arkansas in the heartland of America. Hi, I'm your host, James Bell, and this episode is part of a special three-part series highlighting the latest Fuel for Your Health Accelerator cohort, which is based here in Bentonville at the Ledger. To get started, let me introduce you to Tom Douglas, who is Fuel's entrepreneur in residence. He's also the founder of Catapult Consulting. Tom, welcome to the Bentonville Beacon podcast.
Thanks, James. It's great to be back.
You bet. Well, we're having a good laugh here in the studio because it took me a couple of times to do that intro today. But Tom, let's jump right in. You've been on the podcast before for some of these other Fuel episodes. Will you share with the audience what you would like them to know about you?
Sure. I worked for Walmart for nearly 20 years. When I retired, a bunch of people convinced me to start my own business, so I did. I thank them every day. I also talked to them about what they didn't tell me, but that's okay. And then partnered with the Startup Junkie Foundation on the Fuel Accelerator way back when it was actually a supply chain accelerator before we did AI/ML and health and cybersecurity. So I've been with them since the beginning and just been having a really great time, lots of energy and meeting a whole lot of companies that have been very successful.
Well, perfect. So this is the second segment of that of this three-part series on Fuel for Your Health. Darian Harris was on for the first episode, and he shared about Fuel and what Fuel is doing. Tom, will you share a success story from Fuel?
Well, I wish I could say I could share a success story, but I really have many success stories I could share. Recently, I'm sure you know about things going on with Smart Eye Technology and Dexter Caffey. Yes. There's company Junction AI that's been very successful from a past cohort, and just several success stories in terms of funding and doing well. We have Retail Aware that's looking at potential business and some other things going on that I probably can't talk about, so I won't. We've got plethora of companies that have just, we were talking on the phone with the last year's cohort, and they were getting upwards of $3 million in funding and signing contracts. So it's been just really exciting to see all the companies take what we give them in terms of a network and a little bit of education on how things work on the enterprise side and really blossom afterwards. So I'd like to say there's one. Actually, I'm glad I can say there's more than one, and there's just so many people that have really done well, and we're really excited about that. AlgoFace in Arizona is doing very well, looking at opening an office here. Yep. And all these companies, once they get used to it and understand how the network works here, absolutely are coming to you and saying, hey, there's a great chunk of business here. What do I got to do to move here? And you've done a great job of partnering with us to be able to educate them on what it looks like to run your business in Bentonville, Arkansas. So we appreciate you and the team.
Well, thank you. I appreciate the opportunity to help. And I really appreciate you guys bringing all these companies here to experience Bentonville, because really 90% of the work is done once they do that. I called Darian one day and a few weeks ago. I said, hey, Darian, can we tally up a number for me real quick that I need? And we tallied up in just outside of a few minutes, just in one of your accelerators, the artificial intelligence and machine learning accelerator, that just in the last 3 years, there's 18 companies that have either fully relocated here, or a C-suite member or two moved here, or they hired here. And so you're making a significant impact in growing the entrepreneurial community here, the startup community. But as these companies grow, it's going to make for an outsized impact in fairly short order.
Yeah. I'm very positive about what you're saying there, because I think growth is going to happen, and all of a sudden we're going to look over our shoulder and go, wow, that was quick. And it's really, it's great work, right? We have a great community here. Our network of mentors and stakeholders are really supportive, and they do a great deal to support these companies when they come in. And then once they're here, It's funny. I talk about this with two people, Dexter and Andrew from AlgoFace. I was walking into the Ledger building during the cohort, and they're walking in front of me, and everybody in the car is waving at those guys, right? I know the same people, but they're too busy waving at the two new guys in town. Hey, how you doing? And it's just great to see. I mean, it's one of those things that, obviously that's not going to be my hashtag because Bentonville story, but it is really a hashtag because Bentonville, because nowhere else in the world do you have people, decision makers and entrepreneurs waving at each other on the street as you drive by. Or bike by, depending on what you're doing.
That's true. I want to encourage the audience to go back and check out an episode with Junction AI and SwiftGo together, where Vance Ravy from Junction AI talks about this thing about how the reason, one of the main reasons that he relocated here is this same thing. He would be on his way home or to his Airbnb every day, and folks would be sitting out on their porch and waving at him, and they all knew him. And finally, he got his own chair and moved out to his own porch and got his own spot here in Bentonville.
It's just really amazing, and it's just such a diverse but well intertwined community that it makes it really, really easy to have conversations with people here that you can't have anyplace else in the world and feel comfortable about it.
You betcha. You mentioned how you partner with us at the Chamber. Would you like to talk about any other partnerships, any other ways that you partner here in the community?
Yeah, I mean, we partner with a lot of people, and we're very grateful for that, between the Walton Family Foundation, the Arkansas Economic Development. We even partner with the University of Arkansas up here in their facilities. It's just great because everybody is here to raise the tide so that all the ships get a chance to float. So those partnerships are really, really meaningful. I mean, the Northwest Arkansas Tech Summit and some of the other things that we've done in that area. It's just great to have those as additional add-ons to an already great community experience for these folks.
You bet. One last question.
Yeah, sure.
Tom, will you share a hashtag BecauseBentonville story? You already know what this is, but for the audience's sake, if they haven't seen an episode until now, this is something that happened where you look back at it and you think that could only happen in Bentonville, or it describes the essence of this place.
Well, I think what's really fascinating about this place is when you have success, you have so much support. And I'll speak again about Dexter just because I was in the office when he closed his first deal and got his first check, and we just had a great time with that. But then he had his ribbon cutting because he moved his office here, and you were there, and it was just one of those events where it was just so many people that you wouldn't even get close to actually in other communities were there to support him, to be part of the moment, and to congratulate him. And that's really a Bentonville story, right? That's the story where someone comes in, has a great experience in the community, begins to run their business differently because of that experience, and then has a grand opening where you got council people showing up. You got heads of companies showing up. You've got heads of banks showing up. I mean, all these people are showing up to this event and shaking hands, and we're all just having a good time to celebrate a success story. And because we all feel like we just added just a little bit to help. And that's really what it's all about. And that's what this community does. And that's what makes this job that I have right now so enjoyable, because I know those are the things that are going to happen.
You bet. I think that's a good way to close out our conversation. Yeah. And hey, to the audience, get ready. You're going to hear from some of these companies from the Fuel for Your Health cohort. Okay, let me introduce you to Rand Ragusa, who is the co-founder of QuickTake Health. Rand, welcome to the show.
Oh, glad to be here. Thanks for having me.
Yeah, you bet. Will you share with the audience what it is that you'd like them to know about you?
Sure. I'm a New Orleans resident currently. I've been in technology since the dot-com boom, so moved out to San Francisco in 1997 and have been in technology ever since. For the last 14 years, I've been in health tech. So 10 years, I worked for a cloud-based certified electronic health record company. And then during COVID, I sold a thermal imaging temperature check kiosk.
Of course.
That automated the temp checks at the screening stations during the pandemic.
everybody, you're smart to pick something that you can sell during the pandemic.
Well, but the funny thing is that I knew that day was going to end where one day I went into one of the clinics that sold or had my kiosk, and the kiosk wasn't there anymore.
Oh, wow.
And so I went to the front desk and said, "Hey, I noticed the temperature check kiosk isn't at the entrance." And she said, "We're not checking temperatures anymore." And that's when I knew I needed to pivot.
Smart man. Well, let's talk about QuickTake Health then. Sure. What is it that what problem is QuickTake Health solving? And then who's your customer and how are you solving the problems for them?
So today, when you go to the clinic or the hospital, the intake process is a manual process, especially around vital signs documentation. So today, the frontline medical worker is writing your vital signs down using pen and paper. Oftentimes, it's a sticky note. And then they usually walk down to the hall into the exam room, log into the computer, and then type that information in using keyboard and mouse data entry.
Yeah.
And then they throw the patient's sticky note in the garbage with all the other patient's sticky notes. So in 2022, when I discovered the light bulb moment, I knew that was not part of the digital age, that this was a paper-based process that was ripe for disruption in today's digital world. There's technology that exists that essentially would allow you to automate that, and that's exactly what we've done.
Excellent. And there must be a significant time savings for customers and, frankly, an opportunity to turn their attention to something more meaningful, like, I don't know, taking care of the patient.
Yeah, there you go. I mean, it's about 3 to 4 minutes a patient that's wasted. Being distracted, managing multiple devices, facing the computer, entering in the data manually. But more importantly than sort of the workflow automation piece is really the accuracy of the data. So it's a big problem in healthcare. Data gets incorrectly written down. It gets incorrectly entered into the computer. And there's all these steps along the process where a number could be wrong.
Yeah. And
so the trickle down for that is significant because the doctor does their documentation after the patient leaves. And so when the weight's 150 and it was supposed to be 100, they're basing their medication on that weight. And so it's super critical to have accurate data. And then, of course, just throughout the entire system, if the numbers are wrong, then the claims are wrong. And so it's about creating efficiencies and making, more better care through more accurate data.
Yeah, you bet.
Yeah.
Well, so here you are in Northwest Arkansas, in Bentonville, in the Fuel for Your Health Accelerator. How has Fuel for Your Health in Bentonville, Northwest Arkansas, been helpful to you the last few weeks?
It's been incredible. Yeah, we've been here about 4 weeks now. And, the mentors that they have brought together, there's about 40 of them. And they all have a real passion for entrepreneurship. And some of the networking events and the breakout workouts, or workshop sessions that we have are really phenomenal. The insight that we're gaining, and then just, of course, the connections that we're making. That's a big reason that I'm here is because Bentonville offers startups like QuickTake the opportunity to not only learn how to sell into large organizations, but then they actually make that connection. So building those relationships and the networking has been phenomenal.
Excellent. How can our audience reach you or get to know more about QuickTake Health?
Sure. Visit www.quicktakehealth.com and or you can reach out to me at rand@quicktakehealth.com.
Perfect. Well, Rand, I have one last question for you.
Okay.
And this is the trademark question of this show, the hashtag BecauseBentonville question. Will you tell me a story? Share with our audience a story, something that happened where you look back at it and you think that could only happen in Bentonville, or maybe it describes the essence of our city.
Yeah. I would say the first night that I was here, we walked we're in the Ledger, which is this world-class office building right next to the center. And so we walked from there across the center to Blake Street. And just that experience, it was the first time I'd ever walked through the center of downtown Bentonville. And it just reminded me of being in a ski village. Like I felt like I was literally in Aspen or Breckenridge because of it's so quaint. And there's all these amazing restaurants, and it's just a vibrant community. You know, you can feel it when you walk into a restaurant, or a bar. I mean, it's just a lot of excitement. Some of the brightest minds in the world are coming here to start their businesses, and I'm looking forward to being a part of it.
Excellent. Well, welcome to Bentonville.
Thank you very much.
Thanks.
Excited to be here.
Thanks, Rand. This has been great.
Thanks,
great
James.
talking with you.
Appreciate it.
Let me introduce you to Erin Keyes, co-founder and CEO of Telegenixx. Erin, welcome to the show.
Thank you for having me.
What would you like the Bentonville Beacon audience to know about you?
This is the hardest question to lead with. I've agonized over this, personal, professional, the story of my homelessness currently. We're not sure which direction to go. I think what I want the people of Bentonville to know is that I am so excited and honored to be here. I think I have inadvertently prepared my entire life to come to this space and time and really work to see what we can do for this part of the country in terms of bringing health and transformation forward personally, professionally, and beyond. My background's really in public health, particularly focused on global impact. And I think that what I admire most about Bentonville is this really unique intersection of so many walks of life, so many passions, so many opportunities. And we have this chance to help people really capture the best out of life. And I'm excited to see what the next few weeks bring in terms of that.
That is neat. I love it. Well, I tell people if you want to do global impact, you have to come to Bentonville to do it.
Of course.
There's so much that happens here that does affect the globe, and it's kind of pretty cool.
Yeah.
Will you talk about your company? Talk about Telegenixx. What is it that you do? In other words, let's start here. What's the problem that you're solving? Who do you solve it for, and how do you do it?
Yeah, that's a great question. So Telegenixx is a digital health platform. So think a telehealth platform that really focuses on optimizing and improving GLP-1 receptor agonist medication outcomes. So GLP-1 receptor agonists are medications like Ozempic, Mounjaro, Zepbound, semaglutide, and tirzepatide being the active ingredient in those medications. These have swept the nation and the world, likely to be the most prescribed drug ever by 2030. Wow. And I think that this is a huge opportunity for us to really invest in the how that we implement such a radical shift in the trajectory of the nation's health. So Telegenixx is really focused on adding support on the patient and provider side to enhance health outcomes and sustainability, holistic health, and true enjoyment and zest of life as part of a GLP-1 receptor agonist plan.
Perfect. Man, that's amazing. So
it's pretty cool stuff.
Yeah, absolutely. So you're here in Bentonville as a part of the Fuel for Your Health cohort. How has Fuel for Your Health in Bentonville and Northwest Arkansas been helping you the last few weeks?
Namely, I think the network here is phenomenal. I went to business school and we talk a lot about ecosystem development. There's this myth of a solo entrepreneur. And when you think about building this somewhat abstract but very intentional network of people that can really advocate for an idea and find consensus and unity and bringing something forward, I think that's a super unique value proposition. I, come from New York. I spent a good amount of time in Atlanta. I see many ecosystems popping up in Miami, Chicago, LA, the expected places. But there's something really unique and beautiful about Bentonville, the relationship to employers, to health systems, to payers, and frankly, just this really unique population here that is focused on not just avoidance of disease, but really optimizing a life towards enjoyment and mountain biking, obviously, good food, kind of this zest for being, and wrapping all of that up into a cohort with unique perspectives, unique opportunities, and access to people that we otherwise wouldn't run into has been paramount, I think, for shaping the vision of what will be.
That's neat. I had not thought about describing this place that way. Optimizing for a life of enjoyment.
Yeah.
I love that.
I mean, a lot of what we're here to do is endure, but a lot of it is to seek pleasure too.
Absolutely. That's really cool. I like it. Erin, how can our audience reach you if they want to get to know you more or learn more about Telegenixx?
Yeah. Well, I'll be here till at least the end of May. So hit me up for a cup of coffee.
There you go.
Love that. LinkedIn is fantastic. Erin Keyes. I have an Instagram, which I vow to post on.
Excellent.
Erin, Erin Keyes, Keyes _. Very creative.
Very.
Or through our website, www.telegenixx, TELEGENIXX.com. And there's actually a space to book a consultation on the website. And currently, that goes to my calendar. So sign up for some time with me and I'll grab a cup of coffee and we can have it virtually.
Awesome. That's perfect. Well, Erin, I have one last question for you.
Shoot.
And that is, if you will, share a story. And this is going to be a hashtag BecauseBentonville story. In your few weeks here, what's a moment that stands out where you look back at it and you think maybe that could only happen in Bentonville or it describes the essence of the place?
Oh, I mean, what a city of surprises. I'll be honest. I don't think I had expectations coming in about what Arkansas would be. I lived for 10 years in Atlanta, so I adore the American South, but I didn't think Arkansas really fit into that. I've been delighted by the kindness, the welcoming, people. The built environment has been impressive, actually. The walkability, bikeability, town center, the community aspect. I have to shout out one of my business school friends who I ran into, trailing along my 3-year-old who was probably screaming in a, Mirabelle costume or something like that. Running into my business school colleague from a decade ago in a Walmart here who works for Walmart, and getting to see him, meet his kids. That's not something that I get in New York. So that's been wonderful. It feels like home a little bit.
That's cool. You would not be the first person who came here on this show and said, I ran into somebody, and there was somebody, I don't remember who it was that came on, who said they were walking through the neighborhood and somebody's sitting out in their front yard with their kids and the kids are playing. They're like, hey, is that you? And they hadn't seen him in like 20 years or something crazy like that.
We like triple took each other. Like, there's a ghost.
There's no way.
Yeah, it's been fun.
This is where you come to make reconnections.
I love it. That should be like a tagline somewhere.
Totally. Erin, thank you so much. It's really been a pleasure talking with you. Thanks for coming on the show.
Yeah, my pleasure.
Okay, let me introduce you to Dr. Bechara Saab with Mobio Interactive. Besh, welcome to the show.
Thanks a lot, James. Good to be here.
Glad to have you. What would you like the Bentonville Beacon audience to know about you?
About me personally?
Sure.
Well, certainly my favorite hobby is skiing.
Awesome.
It's been a big part of my life since I was very young, particularly backcountry skiing, getting really high up into the alpine, finding terrain that maybe nobody has skied before. That's a huge passion of mine. Yeah.
That's cool. How does one get involved in backcountry skiing? I've always wondered about that. Is it just a friend says, let's go do something crazy today?
Yeah, I mean, it's a friend who brought me into the game. I remember the first time I went. It was the first time in my life where I felt comfortable dying. Like skiing down and enjoying something so much, I'd be like, this would be worth giving up my life for.
Wow.
And then I started to get into it more and more. And I've probably introduced about 6 or 8 of my friends to backcountry skiing for the first time. So that's how it happens. Yeah.
Well, that's amazing. And you are what's your right title at Mobio Interactive?
I'm the CEO and the chief scientist.
Okay. CEO and chief science officer. Yeah. Well, let's talk about Mobio Interactive then. What is the problem that you're solving and who are you solving it for and how do you do it?
There's really 2 problems that we're solving. One is just the fact that mental illness has a very high prevalence rate. And it's almost on par with imperfect vision. So we really need something that is able to address mental health issues in the same way that we have glasses and laser surgery, et cetera. I mean, we need something which is that effective and that easy to scale if we really want to address the problem. And so we're developing tools that are highly scalable on the order of glasses, let's say. The second problem, which I think is intellectually more interesting, is the fact that psychiatry and mental health care in general is alone in medicine by not using objective data as standard practice. Mm-hmm. Everything else really incorporates objective data, and it would be ludicrous not to have objective information on a broken leg or on a tumor or on the degree, the number of viruses that are infecting your system. And this is a problem which has been accepted because it's maybe difficult. The brain is complex. People think about how you feel as being subjective. But as a neuroscientist, as I am, the brain is an organ. I see it as an organ. And what matters, medically speaking, is what that organ is doing, not necessarily what somebody feels or how they say they feel. And so we are doing our best to develop tools that allow us to objectively understand a patient's mental well-being, measuring the efficacy of treatment in real time using that tool, and then making predictions on a patient-by-patient basis. What is the right therapy for that patient?
Yeah, that is wonderful. I've actually that's been the topic of a conversation I've had with a couple of people in the last few days, that there's this really lack of objective evidence in psychiatry. And I'll explain some other time how the conversation even came up. But so it's remarkable that you brought that up. And now I get to say, hey, go listen to this episode because it came up. I had not thought about mental health being on par. Did you say the prevalence is almost the same as folks with vision problems?
Almost.
That puts it in a new
over
light.
50% of people will have the need to seek out mental health care at some point in their lives. So that's a lot of people. And at any one time, you're looking at maybe 1 in 8 people. So 1 billion people on the planet today. These are huge numbers. Mm-hmm. You obviously cannot address this with psychiatrists alone and psychologists and counselors and therapists. I mean, the math doesn't add up. No. So we need scalable solutions, particularly in places in the world where the infrastructure to deal with mental health is close to non-existent. Across Africa, many parts of Southeast Asia, these people have mental health issues as well. Yeah. And there's not a lot out there. So what we develop has the added advantage of not discriminating. It's accessible to people regardless of socioeconomic status and geographical location.
That's great. Well, thank you for your work. How has being part of the Fuel for Your Health cohort these last few weeks, and Bentonville and Northwest Arkansas being here, how has that helped you and Mobio Interactive?
It's been really good, very positive. We went live with a telehealth provider in Louisiana in February. And so this program's timing is also very good for us. Our company headquarters are in Singapore. I grew up in Canada. We have a very international team. But the U.S. is one of our 3 primary markets right now. And so the timing worked out well for us to expand the business in the United States. In addition, it's always good to join programs that help you refine your messaging, your brand, the numbers around your price points, et cetera. And that's something that this program allows us to take a second look at and do a better job at as we continue to grow.
Perfect. How can the audience reach you if they want to get to know you or Mobio Interactive better? How can they do that?
LinkedIn is the best way for certain. Just LinkedIn, Bechara Saab, I think I own the name there. And you can also follow the company, Mobio Interactive, which is also on LinkedIn. The company has a YouTube page as well. We put out videos every once in a while. And other than that, I'm not really active online.
Okay, that's perfect. I've got one last question for you, Besh, and that is, tell me a story, if you will. A hashtag. This will be a hashtag BecauseBentonville story. That's something that happened where you look back at it and you think, you know what, my short time here, maybe that could only happen in Bentonville, or it describes the essence of this place, your experience here.
Well, I mean, something very obvious, I suppose, is the the fact that this program happened to occur during the total solar eclipse. So I wouldn't have been able to see that yesterday from Singapore. But something a little more relevant to the community, I would say, is the fact that, Bentonville is very thirsty for innovation, getting business done. And there's some big companies in the area. And so it punches way above its weight if you measure the weight on the population. But because of the small population, because the town is so small, it doesn't take long to start to feel like you're at home. I've only been here for a few weeks, and already I go out and I'm constantly running into people that I know and saying hi. And so that feeling of community is very accessible to newcomers, which I think is a huge bonus. But that also means that you're not 6 degrees away from the important person that, you can nail a deal with. You're probably only 2 handshakes away. And so that's something which is really exciting. And I grew up in a very small town, much smaller than Bentonville, much more isolated. But I appreciate having some of that essence around here. So I really like that.
Nice. Thank you so much. Besh, thanks for coming on the Bentonville Beacon.
Thanks a lot, James.
All right, let me introduce you to Natalie Shew, who's the founder and CEO of EmployWell. Natalie, welcome back to the Bentonville Beacon.
Thank you.
You've been here before.
I have.
Excellent. So you've been here before with FemHealth Founders. I encourage y'all to go back and check out that episode. Natalie, what would you like the Bentonville Beacon audience to know about you?
Well, I'm a native Memphian who has transplanted to Northwest Arkansas, and now Fayetteville is home. So is the whole Northwest Arkansas region. And I'm the co-founder and CEO of EmployWell. So that's me.
Awesome. Well, I'm not a native Memphian, but as you know, I spent 19 years there. So that's about as close to being native as I can get, I guess. Will you talk about EmployWell? What's the problem that you're solving? Who do you solve it for? And then how do you do that?
Sure. So the U.S. healthcare system spends about $250 billion a year on administrative burden. And it is a primary reason for nurse burnout and turnover, which you probably know is pretty much an epidemic across the U.S. right now. Nurses are leaving and burning out, and it's a huge problem. And one of the big areas of opportunity is actually automating some of these manual administrative tasks and work that our licensed healthcare professionals are spending time on. So EmployWell has created a solution called Provider Ally. And what this does it's an AI-powered assistant that maps clinic workflows and then seeks to automate some of the nurse administrative work and tasks like hunting and gathering insurance, records, and patient treatment information, and then consolidating all that information into one place for the nurse. So big picture, we're really trying to reduce the amount of administrative work that our licensed professionals like nurses and other care team members are doing so that they can have time freed up to do the more important things like direct patient care.
Yeah. That's awesome. If you ever decide that you're going to rebrand the name, just call it Hero.
Okay, yeah. I mean, actually,
Right?
That was our first name.
Was it really? That's
yes,
funny.
Healthcare Heroes was going to be. And then throughout the pandemic, there was a lot of issues around nurses feeling like you're calling me a hero, but you're not really giving me the pay and what I deserve, even though we know they're all heroes and we want to be their hero too. So we kind of went with the neutral ground of ally.
That's really good. Okay, that's fair enough. That works. Can you talk about Fuel for Your Health and how has that been for you and EmployWell, and how Fuel for Your Health in Bentonville and Northwest Arkansas help you, besides the obvious that you're the only Northwest Arkansas-based company in the cohort?
Yeah. Well, we were really excited, first of all, when Fuel for Your Health popped up, and we were too early when the first cohort came around. But by the time, we were ready to be a part of an accelerator, it was very exciting to see that there was something here for a health tech company like ours. And I'd like to mention my co-founder, Stephanie Benton, who's in Central Arkansas. She's a nurse practitioner practitioner, and she actually travels up here almost every week to be a part of the fuel cohort and, the activities we're doing. But I guess the best thing for us has been the local connections to, healthcare leaders, experts, ecosystem folks, even we've been talking to a guy who's an ex-product guy at Google. You've got the enterprise, folks from, Walmart experience, Tyson. So that help and support around being enterprise ready, which we're actually working with smaller to mid-sized clinics right now, but eventually we're going to work with larger healthcare enterprises. And so a lot of the information and, kind of connections we're getting to leaders in the healthcare space here are invaluable because, we want to work with local healthcare entities and organizations. And that's where we're getting exposure through Fuel. So it's been fantastic for us.
Yeah, and that's great because becoming enterprise ready, of course, is Fuel's, I'll say that's Fuel's differentiator versus a lot of accelerators is instead of teaching you how to get from point A to point B and, develop your company, a year worth of development for the company in 100 days. Mm-hmm. They're saying, let's take you where you are and help make you enterprise ready, create operational value in your company and help you learn to sell to large organizations or to sell it all for many companies, which is a really big deal. Because, I've heard that there's this other cash that doesn't start with an F, friends, families, fools, financiers. Yes. There's this other form of cash called revenue, the one that starts with R that probably matters more and actually validates that your company is something. So
that's so true.
They help you get toward that. And I love that about Fuel.
I love that too. And that's been huge for us. I mean, I've had my own consulting business and, service-based businesses and revenue from, in my opinion, is what makes a good business. So it's a little different, when you're talking about needing more upfront capital to, develop your product and things like that. But Fuel has really helped us kind of account for that and then work on some very tactical things like pricing strategy, how to set up a pilot, things like that.
The magic word pricing and setting up pilots. I mean, again, two things that you don't get out of most accelerators. How can the audience reach you, Natalie, or get to know more about EmployWell?
Yeah. So you can always follow me on LinkedIn, Natalie Shew, SHEW. Go to our website. It's employwell.com. So maybe we'll have the full employwell.com by the end of the year. But right now go to our website. You can, contact us there or message me on LinkedIn. It's a great way to get in touch.
Perfect. All right. And I have one last question for you. And this is the hashtag BecauseBentonville story. Tell me a story, something that happened here where you look back at it and you think maybe that could only happen in Bentonville or describes the essence of the place.
Yeah. So I think for me there are so many anecdotes I can point to. And it's usually like, somebody coming alongside me and saying, hey, how can I help you? Can I put you in touch with somebody? Or I know somebody that can help you with that. Direct leads to, potential clients. And it's literally like one, degree away. Like, hey, I'll set up a coffee, meet up for us next week. And, there's just that warmth and that willingness to help others and really wanting to see this whole region succeed, I feel like is just huge here. And it's made a big difference in, our ability to scale and increase our footprint and get, potential clients and pilot opportunities right here in Bentonville and Northwest Arkansas.
That's perfect. You said something in there I thought was interesting. You said, and a coffee next week. Yeah. And one of the other cohort members said to me, was talking about the speed at which people help startups here and that they proactively do it instead of waiting, which I think is really interesting because I see in a lot of places people don't understand the speed at which you move and that you need to meet with them right away and you need help right away, not 4 weeks from now.
No.
The cohort's half over if they do that, right? Yeah. And I think that is very much part of just the way this place operates too.
I know. We're in the South, but we don't Like business does not move slow here, like other things move slowly here. I'm a Southerner, and I feel like this is a place where that innovation is happening very quickly, and the willingness to make connections and make deals happens very quickly.
Absolutely.
Yeah.
Well, Natalie, thank you so much for coming on the show.
Sure. Thank you.
Thank you for joining us and being part of these inspiring conversations. I hope you're as thrilled as I am about how the greater Bentonville area is helping these founders, how the people and organizations here are guiding and supporting them, and about the opportunity they have for a long-term relationship with and in our community. The Bentonville Beacon podcast is brought to you by the Greater Bentonville Area Chamber of Commerce, where I serve as Vice President for Economic Development. If you enjoyed hearing from these founders from the 2024 Fuel for Your Health Accelerator, make certain to check out the other 2 episodes in this special series. Remember to share this episode with those who appreciate the intersection of entrepreneurship, community, and growth. And whether you're watching on BentonvilleBeacon.com or YouTube, or listening on your favorite podcast player, hit that subscribe button and stay updated with our latest conversations celebrating the people and ideas fueling the rise of the greater Bentonville area and making our community a beacon of progress and inspiration. See you on the next episode.